Good morning, everyone, and welcome to the COVID-19 Innovation Summit. We are so excited to have you all here today. We know that this is a very important conversation for us to be having, a very timely conversation for us to be having. As we get kicked off here, I first want to introduce our CEO, Siobhan, who will get us formally started.
Thank you, Nick. Welcome to everyone in the healthcare innovation community. MassChallenge was born in a time of crisis in the Great Recession of 2009. Our mission is literally to address the world's massive challenges, and this is why we're convening this important conversation today. We believe in the power of innovation and its ability to improve lives. Some of our startups stepped up in the last week to retool their processes to manufacture face masks and shield for our frontline healthcare workers in Massachusetts. It took less than 24 hours to mobilize these amazing innovators. We have companies working on home tests for COVID-19 and others looking for ways to contribute in any small or large way they are able. We hope that the people attending this COVID-19 Innovation Summit will help the world and our country in its time of need. I'm grateful for your engagement today. Now I'll pass it back to Nick Doherty to kick off the program.
Awesome, thank you, Siobhan. I'm really excited about today. We have a lot that we want to cover. And first, I want to introduce someone else that will be helping me with some of the transitions. So Natalie, do you want to say a quick hello? We'll bring you off of mute.
I will be introducing the startups during the Innovation Spotlight series throughout the event and looking forward to engaging with you all.
Wonderful. So now you have a sense of who the faces are that are going to be jumping on and off. I want to dive into sort of this first question. Why are we here? We recognize that this is an enormous pandemic that could potentially kill millions of Americans and people around the world. We have to take this seriously. We have to innovate to be able to address this. And this is not just a medical conversation. This is impacting the economy. It's impacting people's lives. And it's very important that we bring this global community that's come here today to work together and address some of this. And it starts with some simple things. I know a lot of you have seen a lot of this, but please wash your hands, practice social and physical distancing, stay at home if you're able to, clean and disinfect, and please don't hoard medical supplies. We want you to please donate them if you have them to your local healthcare institutions. They are needing it right now. So please do that. And if you have a solution, we are starting to collect these solutions on our website. So if you go to solutions.covidsummit.health, you will have the opportunity to submit your solutions to address this pandemic. Many of our entrepreneurs have been reaching out to us asking how they can help. Many of our partners have been reaching out to us saying, we need help. This is something that we need you to go and do. Right now, if you have a solution, we want to hear about it. We want to connect you with the people on the front lines that are addressing this pandemic. And it's critically important to do that. It's why we brought everybody here together today, is because we know that it's important for us to get the right information right now from some credible resources, and for us to be able to meet this pandemic, innovate, and help flatten the curve, and help deal with the aftermath of this pandemic. So some ground rules today. The agenda is on covidsummit.health. Please use the chat on YouTube to post any questions. So right in the comment sections there on YouTube, please post your questions. If you want to promote this on social media, please use the hashtag COVID Summit and mention us on Twitter. And if you need a break, please hit pause on YouTube. This is action-packed, back-to-back, all day, or not all day, but for the next couple of hours. And we want to make sure that we can get to all this great content. So with that, I want to introduce our first speaker of the afternoon or of the morning, Brian Anderson from MITRE Corporation. Brian?
Great, thanks, Nick. So my name is Brian Anderson. I am a physician data scientist. I'm MITRE's Chief Digital Health Officer. And what MITRE has started to do over the past 2 weeks is begin to convene a coalition of private industry stakeholders to develop and coordinate a response to the COVID-19 pandemic. 2 weeks ago, we were in our offices and we began fielding several calls from a number of companies asking, what can we do? How can we work together to address this in a rapid, massive way? And one of the things that MITRE does well is help to coordinate and facilitate public-private partnerships. And like everyone on the phone, we're deeply invested in helping our neighbors and ensuring that all of the assets and resources collectively that we can bring together can be brought to the battle against COVID-19. And so what we did in partnership with Mayo Clinic is developed a coalition. It's called the COVID-19 Healthcare Coalition. You can check it out on the web, c19hcc.org. And the ground rules to joining the coalition are very simple. We collectively believe that it's important to share our plans. Whatever each individual corporation and company is doing, we want to be able to share as much as possible to ensure that we're not duplicating each other's works. And then feeding off of that, we want to be able to identify opportunities where we can coordinate our work. So collaboratively, what problems can we work on together where we can bring to bear the assets and resources and technology and people that want to work on something collectively? And I'll give you an example. Right now, there are researchers in New York that are desperate for a type of therapy called convalescent plasma to be used in compassionate use cases on patients that are, part of the incredible problem and challenge facing physicians in the New York City area. Well, researchers in Michigan State University and Hopkins together a protocol in partnership with Amazon, which is a coalition member, and then brought that protocol live and are now supporting providers on the front lines in New York, delivering this potentially therapeutic medication to patients that are on death's door. It's opportunities like that to bring together researchers and a company like Amazon that has the logistics and capacity to not only turn around the website, in less than 24 hours, but to then, as this potential therapy were to scale, have the logistics to support all the things that go into blood banking and supporting plasma. It's companies like Amazon, like Google, like Microsoft, and dozens more that have come together. That as an example to support the effort. Another example: I just got off the phone talking to the procurement offices of several major hospitals in the New York City area. MITRE is working and convening a group of those same companies that I mentioned to identify suppliers in China and freight carriers that can get masks, N95 masks that are FDA certified from trustworthy suppliers in China to the procurement offices of these hospitals in the next 24 to 48 hours. The ability to coordinate our work together yields this kind of impact. Other things that we're working on, we're identifying best practices across data analytics, right? So these companies, EHR companies, some of them are interested in being able to share data and identify and predict across the United States where the next hotspot's going to be. Is New Orleans going to be the next New York City? That's one of the questions people are asking right this moment. What are the data feeds that can go into helping to assess and predict where do we need to send ventilators? The next major part of our vision is communicating broadly. So whatever we discover and whatever we find collectively as a coalition, we intend to share that broadly. No one stands to gain anything commercially. Everyone who's joining the coalition is bringing their own resources. They're not being paid to be part of it. It's a pure voluntary effort. And then finally, we're distributing our capabilities. So whatever we design and discover and build, we intend to share that with the nation. I'll give you an example of an innovative group out of MIT that you probably all maybe already know, the event team. MITRE began partnering with this team to try to help them to identify, again, I just got off the phone with their potential project manager that is going to help them through the FDA regulatory process. And then on the other end of that, should they get approval from the FDA, who are the medical device manufacturers that could help scale massively a potential ventilator solution for the nation as we struggle to meet the demand, not only of just in the New York area, but for across the nation. It's opportunities like that to partner with innovators, to bring a MIT event team with some of the largest medical equipment manufacturers that are part of the coalition that is going to be making real impact. So if you're interested, my plea and my hope is that you consider signing up. You can go again to c19hcc.org. Consider joining. The vision, again, share our plans, coordinate our work, identify best practices, communicate those practices and those insights as broadly as we can, and distribute our capabilities freely. That's all I have to say. Again, I hope you join us, and back to you, Nick.
Thank you, Brian. We are so excited at MassChallenge to be a part of that coalition, and it's really going to do some amazing work to address this pandemic. And we'll be sharing all the responses from our survey that we shared with the coalition to help in the fight against COVID-19. So with our first panel discussion today, we're going to be talking about governments, NGOs, and the private sector. We're trying to understand what are they doing right now to address the pandemic, and what do we need to know right now? So I want to introduce our expert panel. We have Juliet, Charlotte, Margaret, and Vanessa. I'm not giving them anywhere near what they deserve in terms of an introduction, because we want to dive right into the meat of the questions here. So my first question is for Charlotte of AARP, the Chief Medical Officer there. I'm curious, how do we care for our elders? What resources should families be looking for amidst this pandemic?
Well, thank you so much for asking. So obviously AARP representing some 38 million adults over 50. AARP has launched a number of resources that are available on aarp.org. They host every Thursday a teletown hall for access. There's a Facebook page, and the foundation has created a Connect to Effect for communities. But the most exciting one that is launching today is aarpcommunityconnections.org. And this is a mutual aid website. So anyone who wants to find a small group for resources in your community, create your own small group. And just a shout out to MassChallenge, because one of our partners in this website is Mighty, whom we met at the pitch competition last year. And they are helping us identify the small groups that we can use. There's also volunteering opportunities. So from 9 to 5, if someone needs someone to call them, there's an AARP volunteer that you can find who can give you a call. So that speaks to your comment about it is a tough population for the older adults. Truly, we know that about 1 in 3 adult 45 and older is lonely. And in the 65 and older, it's well over 40% that are seriously lonely. And this no visitation is really a challenge. Right now, my mother's in a nursing home for just a mild PT recovery. My father's living alone. She's 90, he's 91. And there are 2 little islands they cannot visit. She's in palliative care. They can't visit. They've been married for 69 years. So my small recommendation, each of you individually, you can make phone calls. You can set up virtual chats. You can set up group conversations. You can play a game virtually. In fact, you can even ask the facilities, like the nursing home my mother's in. She does FaceTime and Skype. They actually bring that around to the room. And I have to say, there is a silver lining in all of this. My father can now use an iPhone with a caption app to communicate by phone. My mother, who wants to follow the market, has learned to do email on her cell phone. And they're 90, 91, and my 95-year-old father-in-law has learned to FaceTime with his iPhone and show off his apartment where he is isolated in a facility, no visitors. He has to have all the meals in the room. He can't go out of the apartment. So to you innovators and technologists out there, this is a wonderful opportunity for virtual connection, virtual help, how you can teach 90-year-olds to use smartphones, tablets, computers to connect. If you can make it simple, if you can make it easy to use, plug and play, allow people to enjoy, to not feel old, but to enjoy their life, you have the opportunity that even if you're one person alone, that you can have a flourishing life and not just a finished life. So I just want to thank MassChallenge with Mighty and all. You've helped us get started.
Well, thank you, Charlotte. And those are some great tips. Can you remind us again what that website is that you mentioned?
Sure, it is launching today. So, and it's iterative. So we welcome any suggestions. It's https://AARPcommunityconnections.org.
Great, thank you, Charlotte. And so my next question is for Margaret, and I see that there's a lot of fun work from home action going on. So I'm curious for you, what do you see governments doing right now to address the pandemic? So, and I'm also curious, what are we doing locally here in Massachusetts, and maybe what are we learning from some of the global response as well?
Yes, well, indeed, I am working from home, and like many of us, and so there's all sorts of collision of my domestic life, as I think everyone is dealing with. You know, what I would say is that I do have some good news, which is that there really is nothing about this virus or this outbreak that can't be tackled with, our traditional public health playbook. And so that's great. We know what to do. We really know what the plan has to be, but all executing on that is going to require a lot of American camaraderie and ingenuity. And so the framework, the playbook, is what is working in the countries that have had success, is basically four things. One is we have to case identify. We have to find the people who are infected, and that means really rolling out testing on a massive scale. The second thing we need to do is we need to ramp up contact tracing. That means that we are able to find the people who have been in contact and have been exposed. The third thing is we do need to safely isolate people who are infected and support them. And I think that story about, a lot of people are experiencing right now in the hospitals, where patients need support. People need support. And so it's extremely difficult to be isolated, sick, and not be able to be supported. I think what we've learned from other outbreaks, like the Ebola crises in West Africa and around the world, is like we've made some advances in how to do that, and how to be with people even if we can't physically touch them. So we need to roll that out. And then the other thing is safe and supported quarantine for people who have been exposed but are not sick right now. They need to be separated as well and monitored over 2 weeks. Again, that just requires a lot of TLC, that requires a lot of support, material support, and also a sense of solidarity with the community. So, you know what, we can do all those things. Like, those things have been done, and in the United States, we have done them before. It does require innovation, and each of those steps requires some innovation. But, I'm really here to cheerlead. I'm like, let's get on with it. We can do this, but we do have to focus. And until that framework has really come together, we do have to really lean in on the physical distancing, because that's right now the only thing that we can do to break transmission. But once we start, really rolling out testing, contact tracing, safe and supported isolation and quarantine, we can start to relax those measures. And so right now it's up to us. And I think I feel very positively. My only concern is that if we try to take shortcuts, we try not to do those things, we try to make excuses for why we can't do them, and we don't align our policies to support executing on the plan, then I'm worried.
And that is a really important point. If we don't take this seriously, if we don't do these things, it is going to put our system at stress, and it's going to prolong this. So I want to turn this to Vanessa. So let's say that we're not following this, and right now our health systems are kind of scrambling to figure out what's going on. What are we seeing in other markets, and how are we training doctors in the field to address this pandemic? So I agree with Margaret. Let's do all these things and do it well. But what do we do to support our health systems that are on the front lines dealing with this directly?
So I think it's really important to realize that health security is national security, and that's very core to the work that we do at Harvard through the program in global public policy and social change, the work that we've done at Seed Global Health, which has really been this idea that if you can stand up robust health systems that can not only recognize an epidemic, sound an alarm, and mount the response, you can actually ensure that populations can do well, that people can thrive in that, and that you don't see a whole cascade of catastrophic effects. And I think that it's important to realize that we are all vulnerable from COVID, very much in the same way. This has been very leveling in some ways. And in other ways, it's also going to exploit the extraordinary inequities of access to resources around the world, as Margaret touched on already a little bit, and that we have to ensure that we have the ability to provide services to those places that are resource limited and to those individuals that are resource limited, whether in the US or abroad. I think it's been very interesting to watch COVID hit different countries around the world and to see what their respective responses have been. Countries that have been able to be very aggressive in surveillance and quarantining have been more successful keeping their infection levels at bay to some degree, where they've been very proactive about engaging social distancing and social physical distancing, right? Early closing schools have been much more successful in helping to sort of what we call flatten the curve, right? Keep that peak from happening and that surge all at once. And for health systems in sub-Saharan Africa, for example, that are so resource limited, that's in some ways the single most important effort they can do. So to give an example of how proactive and I think upfront to prevent the spread of COVID in their countries, many countries in sub-Saharan Africa took a lot of lessons learned from Ebola, either systems that got built up, surveillance, and the ability to implement some emergency systems. So Uganda just got its first known case of COVID about 3 days ago. It was a gentleman, they were screening at the border. They've had quarantines in place. And they've had screening and surveillance in place since January. They did a surveillance, somebody had a fever. They did a rapid diagnostic test, had an answer within 3 hours, identified the patient as COVID positive, and then was able to quarantine his entire plane from Dubai to help shut down the spread throughout the community. They then announced that night that they would be enacting social physical distancing, closing schools, preventing gatherings of any large scale and size, encouraging people and trying to put accurate information out at the level of the president of the country, really trying to lay out what those layers and steps were for the country. And we've seen that in multiple other countries around sub-Saharan Africa. Training is going to be critically important, making sure that we have a well-trained, robust, and well-distributed health workforce to address COVID, both in terms of its surveillance and monitoring, as well as in the care that will be needed, is critically important. An article actually just came out last night, and I believe it was in BBC, an opinion piece on why Germany, despite being very hard hit, is having a lower death rate than many of its neighbors around Europe. And it actually attributes that to nurses. They have a higher per capita ratio of nurses than many of their neighboring countries. And nurses are on the front line of really the human response when ill, which means they're able to monitor changes, help enact in real time some of the necessary needs for these patients. And so it's very critical that we have all health workforce to be able to support these kinds of responses to help mitigate some of the effects of COVID. And I think that what we're trying to do in Sub-Saharan Africa is to partner with governments to look at what those acute training needs are as COVID does start to ramp up, and to think about how do we not only provide modules around critical care, pulmonary disease, prevention, isolation, and all these critically important protocols, but also making sure that we implement, right? Because it's one thing to make the information accessible, but then you got to make sure it's actually being used. And one of my example of this is there's a surgical checklist that was created that people used to do safe surgery, but people hung it on the wall and nobody actually implemented it. So we also have to think about that extra step and really thinking about what that accompaniment looks like to make sure that we're really enacting these trainings. And so there's been an active request for what those needs are. And many of us partners who are working in Sub-Saharan Africa are partnering to adapt protocols and to help make them more readily available and to implement them and support our colleagues in vulnerable settings.
Well, that's incredible work, and it's amazing to hear about the speed at which some of these countries are responding and enacting some of these changes. And there's definitely some things that we can learn from that. And I want to turn now to Juliet. This is clearly a crisis.
Yes.
And what should we expect about the progression of this crisis? What should innovators be doing to address the pandemic? How do we get ahead of it?
Okay, we'll think about the end before the beginning, but which is good. It's good. We have a goal. That's where we want to. And I think the good news, picking up on, Margaret's good news, we have to always look at good news, is there is actual consensus across every discipline of experts, medical, public health, science, homeland security, emergency management, economic, business, that it will get worse before it gets better, and that the financial hit that we are all encountering will be hard. It will be helped by a stimulus, but it will be limited. And the alternative that many people are hearing about now, about opening up prematurely, which those who are proponents of it, including the president in some ways, are ignoring two things. You cannot have a functioning society with a health system that is beyond capacity. So in other words, if your kid gets sick, the hospital, we're not making this up. The hospitals are already burdened. And we're looking at New York. I'm looking at places like Atlanta now, where Georgia's sort of, and Margaret's family's from there, Margaret's sister's there. Atlanta's at like 94%. The other is businesses cannot function with a thriving plague. I mean, in other words, our goal has got to be, our long-term goal, at least, because I talked to Margaret and Vanessa, our long-term goal is 18 plus months away, which is a vaccine and the distribution of a vaccine. So I've got that as a planner, I've got that back there. So what's between this and there, which is some way to manage the virus. It's not eradicate, it is, we can live with it still being out there, and that's enough. So when I think about recovery as a crisis management professional, I'm not looking for a date, I'm looking for metrics. I'm looking for, as Margaret and Vanessa were saying, for test kits so that I can trace and track. In other words, we can go from the tidal wave of community spread to more targeted. I'm looking for availability of ICU beds, of a personnel health facilities with some bandwidth back, availability of respirators and masks and gloves and all the PPEs that we're talking about, and various other metrics that will then let us open up again. So if the closing down, for at least those of us on the phone or on here, felt like an on-off switch, that sort of just shock of last week. The recovery is going to be more like a dimmer. It will go up and down. It will be different communities at different times. We'll focus on vulnerable populations differently than we might on others. But, and then this is about, none of that gets done on a date certain, and none of it gets done with a hodgepodge social isolation standard. It's not sustainable. We are the only country besides Brazil now, so give you a sense, we are the only country besides Brazil now without a strong national focus on essentially a stay-at-home campaign. Britain folded yesterday. Boris Johnson started to see those numbers. And so, you know, in the absence of that, we look to other leadership. So you're seeing it with governors, you're seeing it with mayors. We need it. You saw it early with CEOs. Twitter, you know, did it immediately, right? And so, you know, my advice to everyone here is, you know, you're now, I keep saying everyone's a president now, you know, I mean, in other words, your capacity to control or to set standards for good behavior for employees, your ability to serve as a model for your conduct, your ability to help in a system that is not being unified. So there's, you know, we're well aware that various mechanisms to provide materials to hospitals like the Defense Production Act are not being utilized. So it's all lean in. And if people want to know, I just pulled it up, so I'm just doing this for a reason. If people want to know there's been just really good NGO and private sector organization. There's a website now called COVID-19 Action, COVID 2019 Action, and it gives a list by state. So this is Massachusetts, how you can contribute resources, personnel, expertise, data management, all that stuff. So good news is the plan is sound. The plan is agreed upon by everyone who knows the field. There's a lot of political complications involved, but the plan has also been validated by other countries. And so that gives me optimism that even if we don't have a president ready to move forward with the plan, you're seeing all 50 states head in the same direction. And that actually, and that direction is hard before it gets easier. So that's sort of what I'm looking at right now. We've never had a 50-state disaster of which every state is going to feel it. The first time in US history. Ideally, we would have a united effort. I don't think we can plan on that. So we do what we do in crisis management, which is you pivot and figure out how you fill those gaps. And so I think that's what you're going to start to see.
Well, thank you, Julia. And it's helpful to just have a little bit of a viewport into what's coming, how people can start to coordinate efforts, and that we're all really in this together, and that we can all be kind of our own president here. So I want to do kind of a rapid fire with the group, and I know that we're tight on our ability to ask some questions from the audience. So first, I want to ask everybody. And this really rapid fire, 1 to 2 sentences here. What challenges or opportunities lie ahead that we need to address? And what should we be thinking about beyond this initial response? And I want to start with Charlotte. Give me some thoughts about what we should be doing, beyond this initial medical response.
So kudos to all the medical and healthcare systems and organizations. I just don't want to forget about the person who's isolated, who's, can be lonely, who's not connected. So think about easy plug and play. And most importantly, if we're relying on voice technology and telephone and virtual calls, think about the hearing impaired. That's 2/3 of everybody who's 70 and older. Are you thinking about captioning? Can it pair with Bluetooth? What are you doing to test the hearing and making sure that they can communicate adequately? This is a great opportunity for the innovators out there. I do think we have real positivity that can come out of this. We know that if you have resiliency and you survive, you have a better immune system and you live longer.
Great. Margaret, what are your thoughts about what we should be thinking about coming up next?
Well, I mean, the sort of 30,000-foot view is that the reason that we're in such a difficult situation frankly, is because we have gutted our public health system in the decades preceding this. So we don't have a public health system that has the labs that can actually run high volume testing. We do not have the workforce in place. We just haven't invested. And that's how America grew up. Okay, we grew up with a strong public health system that was really fought for and built brick by brick. And we need to get back to that. So, that's my one message here is that, yes, we are going to get through this. We are going to come together. We are going to innovate solutions and implement basic public health. But on the other side of this, we need to realize that those are the investments we need to make here.
Great. And Vanessa.
I mean, I think I would have to really agree with Margaret. I've always been an advocate of the fact that health is a critical priority and that we have for a long time undervalued it, underinvested it, and not fully understood how it is got to be front and central to our ability for economic well-being, individual, community, and national security, for our ability to have sort of the opportunity to not just survive, but to thrive. And so until we really value health and make critical investments, and I think education falls the same, we're forever going to find ourselves flat-footed and vulnerable. This is going to be our new reality now. So we have to address it.
Thank you, Vanessa. And Juliet, I want to take at least one question from the audience here.
Okay.
And this, I think, gets to some of the crisis infrastructure and the defense spending that you were talking about. How can we ramp up testing when there's not nearly enough swabs or reagents available? So how far away are we from in-home kits and really widespread drive-through testing sites like they have in South Korea?
Actually, I'm gonna, if okay, I'd turn to Vanessa or Margaret, who probably might have their ear to the ground better on the dates of that. I know it has gotten better. And until it's solved, we can't even begin to talk about or talk seriously about recovery. Just quickly on the other side, when you talk about the surge of resources to help hospital capacity, it's been hodgepodge, but I do feel like things are starting to move. So I'm starting to feel like, okay, someone within government has woken up. But if okay, I'll ask Margaret or Vanessa if they have a better sense of timing.
So
and you got 1 minute here.
Okay. Well, just briefly, I can kind of tell you what in Massachusetts is talking about. As Juliet said, basically every state is a bit on its own in terms of ramping up its testing. Two things. One is, we need testing, but we can also go ahead and proceed with case identification without it in the meantime. Okay. So number one. Number two is that we are, leaning into revving up that testing. I would prefer it take place in coordination with the public health system so that we build a strong surveillance system. If everyone's doing their swabs in their home, for example, which is way down the line, we won't necessarily be able to build up our surveillance of who's negative, who's positive, et cetera. So really what we want to ramp up in the short term is the public health system capacity and partnerships to run high volume testing. And that is, the number one focus here in Massachusetts. It's getting that done. So every week, I think we're up to 3,500 tests a day in Massachusetts rolling out this week. And so we're going full steam ahead. But if you're in a state where that's, I think, a great question to call your local representative or your state representative and ask them.
All right. Well, thank you. That's all we have time for.
So much.
I wish I could talk with all of you for hours. So thank you, Charlotte, Margaret, Vanessa, and Juliet. Keep up the incredible work. And we look forward to seeing more of what you come out with as we address this pandemic. So with that, I'll move on. And I think that this is a timely conversation, talking with some of our innovators about the front door. How do we find who is sick? So I want to pass it over to Natalie, who will introduce our first startup presenter.
Thanks, Nick. Our first startup presenter is Allison Martin, the CEO of YouDoTest.
Hi, good morning, everyone. I'm the founder of YouDoTest. I am South African, and I founded this business 6 to 7 years ago in South Africa to save women from cervical cancer deaths and mortalities related to high strains of HPV. My team and myself have been working very hard for the past 6 years now, and we've predominantly been working B2B. We have an at-home lab testing software platform. And in the past year, across the United States, several awards as well as support that we've received from America lately, we now have a solution that we've been approached by your physician networks in the combating of COVID disease prevention. And together with our lab partners who we have integration with, want to present to you the software that we've designed for physicians across the United States to match them up with labs who have capacity, your independents and your clinical labs who are coming online at a rapid rate. So the platform that we've designed specifically for the physicians that have come to us is in essence the ability to match nationwide labs who have at-home self-collection COVID-19 testing capacity to your physicians who need them. We've designed a very specific and very methodical registration process for these physicians to get access and to give it to their patients. And to be honest, we weren't going to get involved in the COVID crisis. However, there's been significant personal reasons for us to step up. My company and myself, we've got extensive experience in the at-home lab testing space. And now is the time for us to really use our software that's integrated with significant labs and physicians in a very impactful way across the US. So we're proud to partner with leading laboratories, leading American telemedicine associations, as well as physician networks. We're keeping in touch with all of them related to when they all come online, the validations that they're doing. But most excitingly, we have the opportunity to methodically bring more tests to places that need them. So please connect with me either on LinkedIn or directly through Twitter. We have launched a page today. We do need your help. Thank you so much. I'm Alison from YouDoTest, an at-home lab testing platform.
Thank you so much, Alison. That was great. And up next, we have Andrew Lay, the CEO of Bowie Health.
Hi, everyone. My name is Andrew. I'm the CEO and co-founder of Bowie Health. I'm a physician by training. And what Bowie does in our kind of day job during normal times is we built this AI health assistant that helps people figure out what to do when they're sick. We built it by training it on thousands of clinical papers, and it mirrors a conversation that you might have with your clinician. But what we did was, if you don't mind going to the next slide, is that in late January, sorry guys, the slide after. In late January, we were seeing the spread happening in Wuhan, and we were thinking, this is definitely going to come to the United States. And so we took the CDC guidelines and layered them into our AI, such that we are using the guidelines to screen people to help them understand their risk profile. And what I'm showing you here is what we launched on February 5th, which was the ability to now understand, if I have a cough or I'm worried about coronavirus, which of these buckets do I fall in? Am I at low risk based on the CDC guidelines? Am I at risk and I required to, seeing a physician or get testing? Or am I at high risk and I really need to seek care right away? And you can see here that the opportunity is to titrate the supply of healthcare to the demand and helping people understand where exactly they should be going. If you don't mind going to the next slide. And so what we've been doing is either working with our employer partners or health plan partners, people going directly to Bowie, or people finding us, by Googling, coming to Bowie, being scared about coronavirus, and then moving into these different options. And these options will change as testing comes online, as telemedicine queues potentially will fall. And what we've been able to do, if you go on to the next slide, is that we've seen since February 5th, 21,000 different people who have been worried about coronavirus. We've actually helped 77% of them understand that they were at low risk. while finding 4,000 of them requiring help and seeing a patient. What's fascinating is that since we've done this so early, we've actually seen the spread of coronavirus before it's actually been confirmed in different areas. So we've seen this in 12 different states where we've found a pocket of high risk, and then the confirmed case happened days later. So that's Bowie. We're helping people figure out what to do when they're sick, and this is especially important during these times. Thanks so much.
Thank you so much, Andrew. And the last startup presenter to end the Front Door Innovation Spotlight is Christy Ebong, the Senior Vice President of Corporate Strategy at Orbita.
Good morning, everyone from San Francisco, where we've been on lockdown, I think going on just about over 2 weeks now. So it's definitely been interesting experiencing all of this firsthand. Orbita is a conversational AI platform. We focus exclusively on healthcare and life sciences, and we have solutions across the enterprise, but across also different channels. So via phone, chatbot, smart speaker, and our conversational AI experiences are used for everything from digital marketing, consumer marketing, and patient acquisition to population health and clinical operations. The next slide. We've been working on this for about 2 weeks now, maybe 3 weeks now, really looking at customers that are coming to us, frontline healthcare organizations, and saying, how do we support what's happening in the front lines, and in particular, looking at helping with folks who are identifying as either symptomatic, they might be at risk, they might be well, but worried and anxious. And so we have now launched a suite of solutions. First is we launched a free chatbot. This is available to the English speaking population in the US. It's a web-based chatbot that we can get up and running very quickly within your website. We also have a premium version of that. It's a screening tool that allows for screening questions as well as a robust knowledge base that you can then connect to different endpoints. So if you have certain populations that you want to kick over to a virtual visit platform, or to schedule to be seen, or direct them to come in immediately, those are all options. One interesting thing about what we've been working on is we recognize that a lot of the folks that are most at risk are actually not necessarily web and digitally savvy. And so all of these solutions that we are offering are also available via SMS, via phone, either analog phone or landline, so that we can also reach some of the elderly and aging population, or those that are under-resourced, which is, as we know, the COVID-19 does not discriminate in terms of the digitally savvy. And so we have active initiatives underway to launch in multiple languages. We are launching globally in the next 24 to 48 hours. And I think by the end of this week, we'll have about 4 to 5 million patients that we are covering. The second of the solutions that we've been working on is a health check. This is really used to routinely check in on folks who are symptomatic and at risk. And so a lot of our customers on the front lines are looking at, how do we get in touch with our oncology patients that are, have recently undergone treatment via chemotherapy or radiation, and maybe immunocompromised or more at risk. And so that's a solution that's available to check in multiple times, help people monitor at home, take care of themselves at home, and should the occasion arise where their situation escalates and they need to be seen, to get them in a timely fashion. And then last but not least, we've been working for large employers. One in particular is a large medical device company that's well known for ventilator manufacturing. And so we're supporting their 90,000 employee population to make sure that they stay healthy and well and continue to churn out those vents that are so desperately needed. Thank you so much.
Well, thank you to our first round of others. There's definitely some great solutions that are on the front door, and those are just a handful of some of the companies that are out there that are working to address this. So in terms of thinking about our next panel discussion, we want to talk about what should we do to care for people with COVID-19. We have an excellent panel lineup. We have Meg Barron, who's the Vice President of Digital Health Strategy for the American Medical Association, John Brownstein, the Chief Innovation Officer for Boston Children's Hospital, and Jennifer Joe, CEO of Vanguard Health, as well as a practicing physician. So welcome everybody to the COVID-19 Innovation Summit.
Great. Thanks, Nick. Thanks for having us.
Thanks, Nick.
So my first question is for John. So what are we doing to track this disease? What do we know about how it spreads?
Yeah, so great question. We've actually been tracking coronavirus actually since late December, where we built technologies that uncover early signs of disease outbreaks in populations. And so us plus a number of groups were actually identifying this local cluster in Wuhan through epidemic intelligence collecting. But ultimately, it was a very small cluster of respiratory illness. From there, of course, government started taking action. There was a big effort on the part of governments to collect better data on cases. We got incredible insights into what was happening in China. And ultimately, there was a massive sort of cross-country effort to get a sense of how this epidemic was unfolding. I wish I could say that the U.S. was sort of preparing well, as much as we knew that this was coming towards us for months. The alarms were getting sounded, but our efforts to sort of improve surveillance in the U.S. and get us ready were just not quite there. And that was, of course, underlined by many people who have talked about our severe lack of testing, which is sort of a cornerstone to understanding what was happening here in the population early, right? We didn't have the adequate testing that was taking place while cases were unfolding in Washington and California. And so ultimately, we were sort of flying blind on what was actually taking place in the community. But what's happened now over the last couple of months is incredible collaboration across tech sector, across government, academics that are been working to build better data sets, better models, better forecasting. We have a better sense. We still do not have a great sense of what's happening in the community. That's why we launched a tool called COVID Near You earlier this week to get insights into community-based transmission while we don't have the testing. And of course, many of the startups represented here are helping contribute to a better understanding, like Bowie and Orbita, collectively providing better insights into what's happening while we're trying to unlock testing, which really is not anywhere near what we need to get the kind of insights to sort of project and understand how well our mitigation efforts are working.
Yeah, and so that, it's fascinating how it's spreading and how we're all able to, or how we're looking at tracking it. And those tools that you mentioned are fantastic for keeping an eye on it. Now that it's out into our community, we're staying at home. Meg, in your position at the American Medical Association, I know that you're getting inundated right now with physicians that are asking for solutions, as well as entrepreneurs that are coming to you for that. I'm curious what this means for telehealth adoption writ large. You've been working on a telehealth playbook for some time too. So
yeah,
talk to me about what this is meaning for telehealth and telemedicine.
Yeah, thanks, Nick. I think if there's any silver linings from any of this, right, it's that, AMA with many other organizations have been working for telehealth adoption for quite some time at this point. And obviously it's really having a moment right now and being able to step up, to keep providers and, patients safe, or physicians and patients safe on the front lines. Just for a little context, we repeated research this year around digital health adoption, inclusive of telehealth, and found that telehealth adoption was at roughly like 28% usage across the board. And that was actually doubled from 14% like 3 years ago in 2016. So obviously you'd already seen this kind of mini surge happening. And now, we don't have an aggregate total number to be able to share out, but what we're hearing anecdotally and what I've been attempting to collect is, just massive surges across the board. A few things that I've just been, again, trying to tally up and keep a pulse on, and just been hearing from, providers we work with closely. There's groups like, I was hearing from MedStar that they were doing, on average, let's say 20 or so virtual visits a day. There's upwards of 1,000 right now. We've got, Cleveland Clinic, 15-fold increase in telehealth visits over the last week. Jefferson Health, 20-fold increase in virtual visits over the last week. Ochsner, I saw something on them that they were upwards of 6,000 plus virtual visits across the board, and that average, they were at 250 before. So as you can imagine, people are just scrambling to try to figure out how to make this work behind the scenes. And I think all things said and done, doing a great job at it. But, again, looking for resources and really like salivating for, best practices. So, AMA, we've put out a telehealth quick guide that's available on our website and urge everyone to look at that. And we're going to be continuously updating that. And then Nick, you mentioned, yes, we're working on a more broader version of that guide that we hope to get out in just the coming, couple weeks, even next week, potentially. We're working to really expedite that timeline.
That's excellent. And just real quick, do you think that some of these expansions are going to extend beyond the pandemic for telehealth? Is that just a trend that will continue, or do you think it'll change?
I mean, I hope so. I certainly hope so. And I think it's to some degree, like once someone does use something, right, they realize, okay, this is an option on the table. So how can I, improve upon what, the current experience was that I had, both from a patient and physician or provider perspective. But yeah, I think that across the board, once some of this starts to get adopted, there's definitely going to be needed improvements across the board, right? But I think that for sure we're going to see increased adoption, kind of continually moving in the right direction.
Great. I see John nodding his head. Do you want to weigh in on that?
Yeah, no, I mean, listen, we are doing more virtual visits in a given day than we did, the entire, preceding year. So things have changed, and I don't see us going back to the way things were. I mean, in a positive way, right? I think we've opened physicians' eyes to the value. We've opened up, the administration's, eyes to what's happening. Patients are recognizing the value. I think it's, I guess that is the silver lining here, that it's really focused our team to really deploy this at scale. And yeah, I think that it becomes now, these kind of digital practices now become core to the practice of medicine going forward.
Yeah, that's I couldn't agree more. So I want to jump to the front lines with Jen. I know that you are currently practicing and also think a lot about telehealth. And so talk to us a little bit about what we should be doing to care for people once they have COVID-19, or how do we prepare ourselves to meet that? How do we help our frontline physicians?
Absolutely. So thank you for having me. I'm a practicing physician and have been working a little bit with Meg's team over a while. And it's hard what this has happened, but I also think it's a time of change that's actually very exciting that I think we've all wanted in terms of digital health, telemedicine, and really catalyzing it. There were massive barriers to it before, and now in the course of 2 weeks, we've overcome these massive barriers, which is the importance of it, the beauty of delivering care into the patient's home, the beauty of digital data. Meg, your team has just done amazing work getting out really important information. So for the last week, 2 weeks, physicians have just been coming to me saying, we need a better solution. And it's been incredible. I think, John, you mentioned that your team's already has the infrastructure in place, but I work at the VA. The VA's had telemedicine in place for a while, but hasn't used it at scale, and also potentially hasn't used it in all the applications that it can be used in. And I think we know out of Boston Children's, there's a lot of great data on the efficiency of delivering that care in the home, especially for follow-up visits, for tracking that data, just the likelihood of the tracking, following up, and compliance. And we've really seen that happen. So an example would be my cousin who practices in Mississippi, small practice, OBGYN practice in rural Mississippi. She's got pregnant patients. They still need to be seen. They still need to be talked to. They've never in their ever conceived the idea of telemedicine. They were doing telephone visits, but Meg, that wasn't reimbursed to the point where it was as reasonable to do as it is now. So the AMA, I think, has created a lot of pressures for that reimbursement to happen, for that coding to happen. And we've just seen this catalyst so that she, in the course of 4 days of approaching me, getting the resource, Meg, that you were working on, evaluating vendors. They're now fully rolled out on a telemedicine vendor and are doing it like never before.
Yeah, it's kind of wild to see behind the scenes right now how quickly people are actually getting, the solution rolled out, and just the scaling that's happening is pretty wild, but also great to see. So.
Yeah, and I mean, obviously, this is the definite optimistic side of a crisis, that you can have these great sort of technological leaps happening forward. I do want to spend some time on the reality here that much of America is now at home, and people that are in these care settings are, if they're not inundated, they may be inundated. And John, I'm curious for you, like, how are we going to get people back to work? And what's it going to take for us to get there, you think? Like, how are you thinking about that?
Right. I think this is where, obviously we're out of this we never were able to get to a strategy where we're doing containment and contact tracing, unfortunately. But now we're in a big mitigation phase, as you said. And so we're trying to figure out, how long to stay in that. And that's why, of course, understanding illness at the community level is really important, because then we can understand hotspots that are emerging, what we need to do in terms of how much social distancing we need to enact. Right now we're seeing stay at home, that's being, propagated across the country. The big question for us now is like, if there was never a test, but you had an illness, how do you know if you've actually recovered? And so this is where sort of broad scale serology testing becomes really important. So being able to detect whether you once were infected. I think potentially I had COVID a few weeks ago. There was no way for me to actually get confirmation. If I could confirm that through a serology test, then ultimately I could be actually, getting back to work and being productive. And I think that's, if we can start thinking about doing that at scale, all of a sudden now we're sort of protecting those that are still vulnerable while the rest of people can start to head back. And that's, I think, the right strategy going forward.
So serology as a solution to sort of getting the workforce back up and online. One of the probably many solutions that we'll need to implement to not only just not flatten the curve, but just to get people back into the office.
Exactly.
So I'm curious. This is a question from our audience. So the question is, what are the opportunities and challenges you see to keeping clinicians safe and tracking their exposure to the virus? So as they're caring for people, they're getting exposed. How are we staying on top of that, given the limited tests that are available?
Well,
go ahead.
Yeah, no, I mean, I think obviously limited testing needs to be highly targeted at healthcare workers because of their increased vulnerability. I mean, we understand there's increased risk in that population, increased complications. So of course that has to be focused on. At the same time, I mean, of course, there's deployment of the usual things like masks, but also, interesting devices that, people are utilizing. We saw some interesting work done by the ring company Oura, or the continuous sensing device Whoop, where they can give early signs of changes in physiology that might detect early signs of illness. And so providing, our frontline care with the ability to start doing that level of tracking, I think ultimately provides them with the right kind of tools to sort of protect themselves and their.
Mm-hmm. And I would jump in and say that, AMA, and we are in, I know many other organized medicine groups are strongly urging the administration for more test kits and the ability to get those out, as well as PPE to be able to, again, more broadly get that out, because without that, I mean, the broader community obviously cannot be cared for if our own caregivers aren't taken care of. And in addition to that, we've put out this past week a caring for your caregiver guide, again, with making sure that kind of the right resources and just support is there for physicians and those, providers on the front line that, again, if they're not cared for, then the broader community has no chance to be cared for. So I think the importance of that is critical.
Yeah, and Jen, what are you hearing from your peers on in the community right now.
I want to thank everyone for your support, and definitely personal protective gear is number one, most important, and needs to be available. I'm lucky right now the VA has stock. What's key is to have a protocol in place of how it's going to be used, and the protocol in place for how you're treating, managing, and de-risking situations for bringing in COVID patients. I think we've all seen that the testing and having that happen away from high-risk areas. High-risk areas are where other sick people are. So if you think you need to be tested, and you have, potentially hundreds of people who need to be tested, we don't want you to potentially give that to other very sick people who live in the hospital, come into the ER, and go into the urgent care. So clear protocols. We have really nice, clear protocols, and it has to happen. John, I think you guys have seen it has to happen across the board, right? So you have to have the availability of the hospital staff to get that information out to the patient population. You have to have the frontline telephone workers telling everyone, here's the pathway. And then you have to have clear visibility for how you pick that pathway, where you are, and getting safely tested. There's a few other things that at least the hospital system that I work in has implemented to keep our team safer, which is again along those same lines of removing potential COVID checking from the clearly high-risk patients. So I'm confident that we're making very good steps in those directions. We weren't necessarily there 2 weeks ago, and it was very scary for all of us. The frontline workers are still at high risk, and definitely in Boston, we already have reports of when you're seeing colleagues who are my age, who aren't necessarily that high risk, but they're being intubated now. So it's real. We have to protect the frontline workers.
Wow. So I want to go to another question from the audience, and definitely a departure from that. So I just want to let that sink in, that we have sort of young, relatively healthy people that are getting intubated. So all the more important reason why, if you have medical supplies, please donate them so that we can protect our frontline workers. So this question comes from the online chat. Can you comment on the use of telehealth in the context of psychiatric crisis care? So what are there examples that you're seeing nationally of mobile integrated health with first responders in the behavioral health context? Is there anything, I mean, I know that's a very specific question, but are you seeing psychiatric telehealth solutions, and are there any good examples that you're seeing right now?
So I could speak that it's a very stressful time for all of us. It's a stressful time for providers. It's a stressful time for the community. There's a lot of unknowns. It's incredibly stressful to be at home with your children trying to figure out work. I've definitely heard stories that the use of telemedicine for addressing those issues has actually been surprisingly good. So where I've seen those stories are where you already have an established system. So you already have a primary care doctor, or you already have someone who normally takes care of you. They did not typically provide telehealth, but they've spun it up in the last week, which I think is amazing. And they're actually much more accessible than they have been before. So I've heard plenty of stories of people reaching out to their primary care doctor, being seen over telemedicine, which wasn't available before, and being prescribed the appropriate treatments. That might be something to help with anxiety. There's another number of medications there. And then eventually, we've all seen a lot of good apps for relaxation and meditation. And I think those are all nice and a part of it. But I have been impressed with the healthcare systems making telemedicine easily accessible so that you can quickly realize that this is an acute stressor and be treated. So that's really nice in this whole setting.
Yeah, I would agree with that. And I would say, while we commend the fact that, CMS has been limiting the regulations around telehealth for sure, at the same time, and we definitely advocate for the kind of continuity of care and just the, strong bond of kind of the patient-physician relationship. So the fact that so many practices and systems have been able to spin up telehealth options to make that, happen is extremely commendable. And I think we'll only kind of see that improve over time once people kind of get more comfortable with everything. But again, I think that that's essential. And Jen, to your point, yes, like AMA, we have a collaboration with Headspace, and there's tools and resources out there like that, but nothing can really supplement, again, that experience with your physician or provider.
Yeah, and I want to jump in real quick. I'm curious, and we only have 5 minutes left here. I'm curious how the innovation community can support with some of these areas that you're talking about. What are you looking for from innovators? And maybe we can start with you, John.
Yeah,
you're looking across all of this. Where should the innovation community plug in?
It's such a double-edged sword, right? Because on one hand, there's some incredible work and pivoting that we're seeing from companies that, many of whom are doing presentations here today. They've been able to adapt their product, be incredibly fast and nimble, and offer it, free to health systems. And then we're seeing incredible, efforts on the part of our IT group at the hospital to deploy things, and our legal going fast. So now is a great moment to start working with the digital health ecosystem. On the other hand, there's a real challenge, right? A lot of our efforts, like the core efforts of what we're trying to do, have sort of come to a standstill. And so that's the other side of the complication, and trying to push some of those things forward have not gone as fast. And, we're worried that they may die on the vine because they just haven't had the push and the lift. And so, obviously encouraging the ecosystem to think about how to contribute, but, do it in a way that is incredibly constructive and builds on what's already there, versus trying to be super opportunistic and sell in, because it's just not happening in a way that, I agree, it could be a killer to a startup. So anyways, it's threading that needle appropriately to being valuable, but not, taking advantage of a moment that, we're all just spread so thin.
Yeah.
Yeah, and that's something that we're really focused on right now on the MassChallenge side too, is thinking about how do we protect these businesses. So looking at the economic side of this, not every startup is it appropriate for them to pivot and go after COVID-19, and we may need their solutions in 6 months. But unfortunately, there's a reality that some of them might be put on pause. Meg, how can innovators support?
Yeah, some just tactical ways. I mean, we've got a live virtual panel discussion happening as we speak, and we'll be live for the next couple of weeks on our AMA Physician Innovation Network, which allows physicians and companies all across the country to connect. So this discussion is specific to telemedicine amidst COVID, but it allows innovators and companies to directly respond to physicians that are writing in, looking for solutions and looking for just best practices. But also it provides a great way for innovators to be able to amplify or share what they're working on to this community. And just so you know, I mean, in the last, it's been roughly 36 hours since we went live with that, and we've gotten 10,000 views to that discussion. So people are looking to it. The other thing is AMA, we've got a COVID resource center. So I would urge innovators to be looking at that, because we're keeping that continuously updated. So again, in the spirit of not recreating the wheel, because there's so much going on right now, I'd say you could start there, because we're, again, aggregating CDC information, CMS information, all on that site. So I think that's a great place to start. And they can feel free to reach out to me on LinkedIn or anything for, any other details.
Thank you, Meg. And Jen, if you can close us out, how can innovators support our physicians through this right now?
Absolutely. So I think it's a real opportunity. I hear, John, that we are stressed right now, and it's a lot of big change that's happening. And I'm going to be in the emergency room overnight by myself tomorrow night. So first line by myself, 14 hours.
Oh my gosh.
Good luck.
So I think the scary part, I think, is the unknown, right? Do we have the procedures? Do we have the processes? Are we taking all the right precautions? Big systems, John, I think like yours, are still moving. It's hard, but you guys are moving fast. And I was really anxious last week because we didn't know what was happening. We didn't have the processes. We didn't have the procedures. We didn't have what I think the healthcare community felt like was the support we need. And now we feel like it's there. We have clear process procedures to keep everyone safe so that people will not unnecessarily be harmed. So the system's really rallying. From an innovation standpoint, Meg, I think you and I have been working towards digital health and telemedicine now for almost 10 years. And I think this has just shed light and moved mountains. So I think for innovators in this space, it's going to be incredible. These hurdles that have been accomplished in the last 2 weeks, we've been working on for almost a decade. To John's point, everyone's really stressed right now. And right now it's keeping everyone safe. And also telehealth is actually a huge priority because that's a huge piece of keeping everyone safe. But, and then also the testing kits, testing at home, I think it's going to be the next phase. And then a number of remote patient monitoring devices are going to be the next phase. But we are still in the acute phase, and it needs to calm down a little bit. But I think in terms of what it's going to do for innovation, I think this is massive. But we are in the middle of it. And I do want to just thank everyone for everything that they're doing in this crisis. And I've been really reassured and inspired by how the community has come together.
Yeah. Well, thank you all. And thank you for sharing your expertise with us today. I'm inspired that hopefully there's some good things that are coming out of this. And Jen, and to all of your colleagues on the panel, best of luck to all of you as you look to address this pandemic. Thank you for your time today.
Thanks, Nick. I'm glad I didn't have to wear pants for this.
Yeah, that's good.
Can we make you stand up? Sorry about the donuts earlier. It was a holdover from another conference.
It's all good.
I like it.
All right.
Bye, guys.
Bye.
So I want to get into our next innovation spotlights. So we're going to be supporting care infrastructure now. So how do we coordinate care in a pandemic? And our first startup company that our innovator is going to be Michael Doctor from DocHealth. So welcome to the summit, Doctor.
Hope you guys can hear me. Good afternoon, everyone. I'm Michael Doctor. I'm a pediatric gastroenterologist at Boston Children's Hospital. I was a former clinical director of innovation. I had the great pleasure of working with John Brownstein. DocHealth is a HIPAA-compliant task management and collaboration platform built specifically for healthcare. If you can go to the next slide, I'll be able to show some features there. So, DocHealth was really built out of my own frustration and my personal burnout and pain points of having the challenge of dealing with all the administrative to-dos of healthcare. How do we work together as a team? How do we track things? How do we deal with all the emails and the Post-it notes and all the sort of checklists that are necessary for quality patient care? How do we create a task, assign it to someone, delegate it where appropriate, and follow it all with patient context in mind? How do we provide that control and transparency? So we recently launched out of Boston Children's Hospital. If you can go to the next slide, please. And I think like everyone else, we were faced with the real challenge of, how do we respond to this incredible public health challenge? If you could just maybe forward the slide a little bit. There are some bullet points below that, hopefully. So, we felt compelled, my slides are a little wonky. Well, apologies. If you can go back one slide. We felt compelled to act in the face of this public health crisis. And essentially, we've already built a platform that allows teams to work better together, to create structure and process where that doesn't exist. So we've taken the best of the CDC protocols and all the sort of guidance that's been given by the CDC and these long web pages that are fairly complex to follow. And we've created actionable team task lists so that your team can be coordinated and collaborate. You can track where that process is. And the hope is really to get teams both internal to an organization and frankly outside of organizations. How do we get them working better together to track these tasks, to manage them, to prepare for this impending public health crisis? So if you can go to the next slide. Very simply, DocHealth is a web and iOS platform. Sign up takes 5 minutes. There is no EHR integration necessary, and this is a tool that really is intended for teams to get on the same page, to work better together, to regain the control and focus on what matters, which is our patients and this public health crisis. Please check us out at dochealth.com. Thank you, everyone, for your time.
Thank you so much, Michael. Up next, we have Doug Williams and Christina Butenko of One Up Health.
Hi, guys. So thank you again for inviting us to join this summit. We're definitely very passionate to see how our platform can fit and help with the COVID-19 response. In terms of a little bit about us, so we're essentially a FHIR API platform, and our goal is to provide data access to patients, providers, and insurance payers from the 10,000 hospitals that we're currently live with, which actually gives us an opportunity to access around 90% of the US population today. And the nice benefit of the FHIR standard is that you're actually able to get structured data of the patient medical profile, basically from patient demographics to their lab results, to doctor notes, immunizations, prescriptions, and so forth. And Doug can cover in terms of kind of where does One Up Health fit with COVID-19. On the next slide.
So again, thank you. We have three main areas that we're currently helping in COVID. The first is the ability to connect to these 10,000 health systems today through the new patient APIs. And we're working with quite a few telehealth situations, really to echo what Megan and John and Jennifer talked about. We're seeing the same thing. These APIs were intended to make it easy to get for the patients to share their records and then share it with their physicians. So we're seeing a lot of those. If you have those, reach out to us. We're also working directly with hospital systems and provider networks, both to receive the data from their patients, but also to work remotely using our APIs. And then finally, we have a FHIR applications gallery where we're promoting a range of applications using these APIs, many of which are now being used for COVID.
And then if you guys are interested to learn more about these applications, you can email us here. Thank you.
Thank you.
Thank you, Doug and Christina. And last to end the supporting care infrastructure session is Tanya Perkins, the COO of Tembo Health.
Hey there, my name is Tanya Perkins and I'm the CEO of Tembo Health. At Tembo, next slide, our mission is to improve health outcomes for America's seniors. We do so by being a telemedicine practice that partners with nursing homes to provide their patients with care in hard to access specialties like psychiatry and cardiology. The problem that we're trying to fix is the fact that over 50% of America's seniors just don't have adequate access to specialty care, and that this problem gets worse if you're in a rural area or in a nursing home. This problem has become even more acute in recent weeks, basically as patients are scared to go to their providers, or even as government agencies have recommended that nursing homes limit visitations for the foreseeable future. In reaction to this, we have started a number of initiatives so seniors can get proper care. First, we've made some changes to our core operations to increase the number of patients we can service through telemedicine, and in turn, reduce the number of patients who are unnecessarily exposed to COVID. Changes include things like the introduction of an entry-level model in which we can basically start with the home within 2 weeks at little or no cost to the facility. Additionally, we are rapidly scaling our provider team to increase our capacity. Next slide. Additionally, we are deploying several new products. First, we are offering our platform to general practitioners who service nursing homes so that they can service their patients through telemedicine. Second, we are partnering with AARP to allow our patients to use our technology to teleconference with their families and volunteers and reduce the risk of social isolation. Three, we are offering our platform to private practices so they can see patients in the comfort of their own homes. Next slide. If you'd like to learn more, please visit our site at tembo.health. Additionally, if you'd like to help us improve health outcomes for America's seniors, please refer us to nursing homes and private practices, and also direct clinicians to our career site. Thank you.
Thank you, Tanya. Very, very much appreciated the work that you're doing. Really critical at this time. So we'll give a virtual round of applause for our innovators that joined us today. So I want to jump into our next panel discussion. It's about how do we help people in a community experiencing economic turmoil and medical uncertainty. And I am thrilled to be speaking with these two panelists. Alexandra Drain also serves on our board of advisors for MassChallenge Health Tech. She's the co-founder and CEO of Rebel Health and Arch Angels. And we have Alan Gilbert, who's a vice president of Anthem. Both of them are bringing such incredible perspectives. So welcome to the COVID-19 Innovation Summit.
Thanks.
All right. So what I want to start with Alan here. So given your position with Anthem, but more importantly, your perspective in the years of work that you've been in this space, and your expertise around social determinants of health, I'm curious, what are the first things that we need to solve for so we can address this pandemic and help people in our communities?
Great, Nick, thanks a lot. And I hope you guys can hear me. I'm sitting here in my basement. So, and that's one of the first things I would say. So boy, I would say to you that the power of community has never been so clear in a pandemic like this. I think the nation is having really a social needs and social determinants of health conversation as we speak. And I think we don't realize the magnitude or the capacity that community has in solving these problems. At Anthem, I'd say, the first thing as we think about our communities, we think about our home, and that is our associates and their families. And we are really working to protect the health and safety of those individuals so that they can, in turn, continue to serve our customers, which are the 44 million Americans and families that we represent and that need more than ever, healthcare services. And so, for example, we are no longer traveling across the world and the country. All of our employees are really on business essential services. We have moved to home for most of our 65,000 plus employees. We are really thinking about helping them so that they can stay healthy. So, for example, we've expanded emergency leave for up to 80 hours for many of our employees if they qualify. We are doing everything from installing internet services and paying for those monthly bills for the employees so that they can be at home, continue to do their work and encourage their families. And then we're looking at their social needs as well and trying to address those as they are home with their families and children. So I'd say first and foremost, we are really looking at those issues in challenging times. And then beyond that, we are really focused on increasing access to care, while we're eliminating barriers for cost and helping alleviate the added stress on individuals and families that may think that they are, they have contracted the disease. And so we are really working in that end to meet the needs of those providers and consumers as we go forward. And then at an additional level, our efforts at our Anthem Foundation and our company are really swinging into high gear to provide funds to support organizations that support these basic services and community-based organizations on the ground, whether it be through the Red Cross or direct relief or Feeding America. And we're providing flexibility and additional resources on the ground in those communities.
Thank you, Alan. I mean, that is a lot to spin up and coordinate in a very short amount of time. And I got a question coming in that I want to address right away, which is, what are social determinants of health and why are they particularly relevant to approaching this pandemic? And I apologize for not setting the table first in this conversation. So if you could give me a quick definition and why they're relevant, that would be very helpful.
Sure. Most people think of their health as only comprised of when they walk into the doctor's office. And if anyone on this call saw the panel before and of the incredible providers on the front lines, they heard a lot about the services. But frankly, where we are born, where we live, where we age, where we pray, where we work, those determinants, those social needs have more to do with our health than healthcare. So healthcare is health is more than healthcare. And so lots of people are surprised to understand that only 50% of our overall health is determined by clinical care. The rest is things like our adequate, income, our access to healthy and nutritious food, our stable housing, the neighborhoods we live in. All those issues really have a bigger consequence on our overall health than do the clinical care. I always like to say, if you're a person has diabetes, but you are worried about putting food on your table for your family, you're not really thinking about managing your diabetes care, are you? You're worried about food on your table.
Yeah, and Alex, I want to turn to you on this. You've interacted with so many like capital H human beings, and you've really gotten to know them and their lives. And can you talk a little bit about maybe dive a little bit deeper into what those social determinants are, and maybe paint a picture about how we keep our humanity through this crisis, where some people are frankly, I mean, if you're having to stay at home alone, you're basically in solitary confinement. So how do we think about people that are going through this right now?
So first of all, it's such an honor to be here. Nick, you know I love you madly. Alan, Gail Boudreau is, I think, a beacon for all of us in how to lead in hard times. So kudos to you for working with her. I think what you guys are doing is amazing. I love that you just said capital H, because the first thing I'll start with, having spent years now just out and about in the wild with real people, is just acknowledge that we have to expand the definition of health to include life, because when life goes wrong, health goes wrong. And one thing we can count on is humans are awesome. And every single person out there has a beautiful story, and everyone is doing their very, very, very best, and they're loving on each other. And I think there are people who are very lonely and who are very isolated and who are very vulnerable. There are also people who, I'm very lucky, here I am in my home office. I have a nanny who's gonna, or a family member who's gonna make sure that nobody comes running into my office. So we have almost like a kid running behind us. But we have family in Italy who are 8 people in a 2-bedroom, who have not been able to leave their where they live at all. 2 of my cousins are teachers, and they're trying to teach remotely with 3 children under 4. So I think we're incredibly blessed to be in the situation. I feel very blessed to be in the situation that I am. So it harkens back to this notion, Alan, of community. And so I think the most important thing any of us can be doing right now is to be loving on one another, and be recognizing that when you talk about the social determinants of health, I think about a lot as Maslow's hierarchy. And in the healthcare system, we think a lot about, oh, let's make sure you're taking care of your diabetes, and you're taking care of eating well, and you're exercising, you're doing your preventive measures. There's nothing like a pandemic to remind us that we have to start on the bottom, which is to make sure, first of all, people are safe, that they have food, that they have access to the basics. But I would also say that even people who have those basics shored up, so who are very lucky, like anyone who's on this call probably is, to know that they will have food on the table tonight. That doesn't mean that they are not in a situation when they're locked in a home with somebody with whom there could be domestic violence. We know that there is a curve. People are using the term curve to talk about how we have to flatten the curve. I would argue we're also seeing more evidence that it's really going to be more of a wave. So what's going to happen is we're going to have the initial spike, but that as it comes down, we're going to start seeing these waves occurring. I was on the phone the other day with Margaret Laws and a bunch of other extraordinary entrepreneurs, and we were talking about this wave, these waves that will happen in parallel, or actually just following right behind it, which is these increases, these secondary effects of the pandemic. So what we're going to see is increase in drinking. We know that many businesses are not being shut down. Because what would people do if they didn't have alcohol to help sort of mute the effects of this anxiety and despair that people are having? We know that there'll be increases in addiction, there'll be increases in obesity. We joke about, in my house, the COVID-19, which I'm well on my way to gaining, being stuck in the house. And we joke about that, but that's also terrifying. We'll see a ripple effect of diabetes. So I think this notion, when you ask ourselves, what can you do? The best way to reduce anxiety and overcome despair is action. What you can do is start by following, staying at home, and then love on one another and do everything you can to be lifting each other up.
I think that these are some incredible points, and I want to sort of double click on so many of them. So I'm kind of curious about that. I mean, talk after this, how, we'll all gain 19 pounds, but I am curious, what does it look like after COVID-19 is over? And maybe what should we be preparing for? Or maybe even if COVID-19 isn't over, you talk about how do we love on one another? How do we do that? How should we think about that? How should we be preparing for that and be there for each other?
Do you want me to go first?
Go for it. Go for it, Alex.
Go ahead, Alex.
Well, one of the things that we've talked about a lot is caregivers. And if 2 weeks ago in the US, there were 44 million unpaid caregivers, and unpaid caregivers as opposed to paid caregivers are those folks that are on the front line right now, doctors, nurses, techs. But the unpaid caregivers are the folks that were 44 million before. I'm caring for an aging parent, I'm caring for a loved one. If it was 44 million 2 weeks ago, that number has jumped. It's at least doubled or tripled or quadrupled in the last 7 days. And that's because I used to think that I wasn't worried about family member X, but now if family member X is at risk, then I am responsible for their care in a way I never was before, and I can't necessarily get to them. And so I'm stressing about what I could do to be watching out for them. And so I think back to this notion of community, what you're seeing is this unbelievable outpouring of love for people doing everything they can to represent. And if I'm stuck in my home, what I feel is hopeless, and that adds to anxiety. So what can I do? Well, if you have access to technology, you can be reaching out to your loved ones over the phone. If you don't have access, over FaceTime or other kinds of social media or other types of visual connections. If you can't do that, the least you can do is pick up the phone, get your kids to write letters, be doing things. We talk a lot about look, love, and lift. Wherever you are, look around you. There are caregivers everywhere. Recognize the love that they're doing and lift them up. And when you go to the store, please, if you're in lockdown, but you're allowed to go out to the store to get these go to essential businesses, take a moment to say, thank you so much to the people who are risking their lives. There is a new definition. We think of retail at my company as the front line of health. Those are also first responders, the folks who are stocking the shelves. They're folks who are risking their lives to be out there. Obviously, to our nurses and doctors, Jennifer, Joe, you rock. Thank you so much. Good luck tonight. But that's true also for the people who are keeping our economy functioning so that we can be moving. So I think stop what you're doing, say thank you, care for others.
Yeah. And only thing I would add to that is on talking about caregivers, and I think this calls about innovation, and I think it's really, you asked Nick about where we go from here, in the future, and I think it's really showing, I think, the real need for digital transformation in health and in public health, and for more innovation around things like caregiving. Nick, we've been working with some startups in that innovation space with employer provided care with some of our customers, and I think we need to really sort of now more than ever know that is more critical than ever. And we've already done things with our sort of digital capabilities, really quickly, just like you heard in the last panel, working to push out a Sydney app that's available to everyone. But for our members, it allows them to downstage through, using CDC and WHO guidance, downstage whether they think they have corona, and then from that really access a doctor live on telehealth or telepresence, and then that includes, of course, expanding sort of our access to mental health services and psychiatric care as well, right? So, but we need to even go further and think about what could the future look like if we were also saying, if you need food, here's a way to enroll in SNAP and WIC, or if you need caregiving, here's something else. And so I think since this conversation is really all about, what's the innovation, where's the innovation coming? These kinds of crises are really opportunities to step back and look at where that innovation should head. And I think we're seeing it more than ever in conversations like these.
I know yeah, go ahead, Alex.
I was just gonna say, I think, there's the traditional definition of caregiver, which is paid or unpaid, but I would also argue any of us who are in a work environment are caregivers also for each other. And I think whenever we're starting a Zoom or a conference call or however we're now learning to work remotely, which is hard, keep your pants on, John Brownstein. I think we should start every meeting by doing a quick touch base on how are you, and remind each other that we are humans first and we are there to support each other first. So just by taking a moment to go around and be like, are you all right? Is there anything I can do to support you? Is also modeling that we are caregivers in every sense of the word, no better time than now. And I think, Alan, knowing what I know about Anthem and the Blues in general, you guys are about the community. You represent and extend out into every single corner of every single town. And so activating all the mechanisms that I know that you're activating, that we're seeing Blues plans activate across in this broader definition of what it is to care, and getting creative using digital, but also remembering that a huge percentage of the population doesn't have access to digital. So in that world, what can you do to support the loved ones who are around you, the people who are the first responders?
Yeah.
Alex, this is our mission and vision, really to care about the lives in our communities, and we're activating and firing at all cylinders. I'm sure I've heard that already today, but I mean, we really do need to, and as leaders in organizations across the country, we need to all sort of model that behavior. And I start every one of my emails and every one of my teleconferences now with, like, I hope you are healthy and safe. How are you doing? And so that is, I think, is so critical that we remain grateful for our colleagues and grateful for the communities we're in and our neighbors. And we try to, lift everyone up. It's so critical in times like these.
I love that, and now I'm regretting how I've started all of my panels so far. So from now on, we're going to check in and see how everyone's doing. So I'm getting these questions coming in, and I have a few more, but I love sort of this beautiful question. So I'm a high school senior pursuing a career in global health. I'm so impressed with all the skills of your panelists. How can young people help without the depth of experience that these experts have? So how do we get, not just the experts off the benches and helping out? How can everyday people, even high schoolers, get involved in addressing this pandemic?
I'm sure Alex can talk about a lot of experiences. I have a high school senior as well whose prom dress just arrived yesterday, and so she's pretty devastated about that. But I will tell you that she is in walks around the neighborhood, reaching out to our neighbors. We have elderly neighbors in the neighborhood. She's thinking about them. She's doing a lot of outreach to her friends. She's doing a lot of outreach. She's caregiving really, to my mother, who she's talking to much more than she ever was before. In my household, we say there's always a silver lining, and here our family back together, us four, even gaining those 19 pounds is a blessing in disguise in some sense, right? Because I have a son that's in college, home from school, a daughter in high school. So, but really reaching in the neighborhood, I think, is where compassion really lies. And I see that in communities in my conversations with all of our health plans across the country and 23 states and DC in the Medicaid market, where there is such a compassion from our employees reaching out into their communities to try to lend a helping hand. What can I do to volunteer? Of course, respecting social distancing is somewhat of a challenge when you start thinking about volunteering. So innovative ways to do that, I think, is really important. And it's for all of us, not just my 17-year-old daughter with her prom dress, but also with, for all of us to really reconsider.
Alan, I don't know if you'll agree with me, but one of the downsides of getting older is social distancing is a little easier. I can imagine if I were a teenager, I'd be like, no way, I'm breaking all the rules. You can't lock me down. So to the beautiful teen, whoever you are, who just said that, I want to start by saying, get on this call. You are an activist. The fact that you are taking interest and doing what you can and learning. Step number one, you're a rebel. I appreciate that. Thank you so much. We use a term, I want to build on Alan, everything you said, I agree on 100%. We talk a lot about the Facebook self versus the Google self. And your Facebook self is a person where you pretend that everything's awesome and you're so smart and you're winning all these awards and you're great and your life is perfect and you're doing well at school and you're doing well at sports and your family's healthy. And your Google self is a self that was me last night at 2 o'clock in the morning, as I literally was sweating in a panic about this call, about the people I'm caring for, about am I making the wrong decisions at work. That's who we really are. And that is our transparent, most authentic self. And I think one of the things, hopefully, that this horrible thing is going to do, it's going to help us all be more raw and more real with each other. So you're a teenager, what you can do is get out there and speak your truth. And in doing so, you give other people permission to do the very same thing as well. Because I think if we all saw a little bit more into how vulnerable we feel every day, let alone during a pandemic, let alone if you're an hourly worker who is either lost your job or is about to lose your job and you're supporting kids. I do a lot of work with Prudential, and they did some research during the 32-day government shutdown. 25% of government workers, so think about the stability of being a government worker, you think it's pretty strong, 25% of government workers took out a loan. That was a 32-day government shutdown. I just want us all to remember for a second those ripple effects from an economic impact from folks who are already facing the devastation of being responsible for extended family, not having the finances, not being able to go to work. There's the impact from that perspective is real. So we got to love on one another with radical transparency, own your own truth, understand that other people are feeling scared and vulnerable, do what you can to support them, and don't pretend that things are awesome when they're not, but there's always hope. So do what you can to be lifting other people up. Look, love, lift.
Thank you. So I want to awesome questions on this panel from our audience. So next one I want to direct towards you, Alan. So the question is, my company is removing its work from home mandate. Any advice on arguments to make to convince it to prioritize its community's health over its own business? You know, I got to imagine that's a pretty horrifying position to be in. So how do they make that argument? What would you recommend that they share back with their employers?
Well, I think, you know, and if I understand the question correctly, you're saying this. The question is, I'm going back to work. I'm going back into my office environment and
being told to go back to work. Yeah,
exactly right. And I guess, you know, this is a struggle, right? This is why this country is taking the dramatic steps that it is today, right? Because we know if you're a worker living paycheck to paycheck, or even beside that, if the choice is stay at home, I've got a cough, or you know, or go to work because I'm worried about losing my job, you're going to likely go to work, right? Because you need to feed, you need to support your family. And so I think it's really important to just to understand the dynamics of the business. I don't know. I mean, I would tell you that from our own perspective, again, respecting our own employees at Anthem, we obviously have a percent of the population that are on the front lines. We have clinicians and they have to be at work. And so when they are in our offices, we have taken really dramatic steps to make sure they are safe while they are there. And so that's the thing that I would really focus on, not only just, you know, deploying hand sanitizer, et cetera, everywhere, but really respecting social distancing and really moving workstations to the parts of our buildings that aren't occupied because people can work from home. So if we have those, and we have folks that have to be on the job 24/7, and let's be honest, some of our jobs are not able to be done from home, right? Just like our frontline responders in the country. And so you just try to push that so that you can respect social distancing and try to be as safe as you can when you have to do your job. So is what I would say. And of course, if you're one of those vulnerable populations and you need to remain home and you need to be outside, I think you need to make that argument to your respective employer, your leader, et cetera. So I would argue that.
Thank you, Alan. So I want to do a couple, just one rapid fire question to close out here, and that's sort of turning to the innovation community, turning to our entrepreneurs. Where should they focus their energy today, and where do you see their energy needing to be focused tomorrow? What's coming up next? So would love sort of what needs to get done right now, and what should we be prepared for coming next? And we'll start again with you, Alan.
Sure, absolutely. So, I mean, a couple things. I was reading an article the other day about the grocers in the country and how they have fought for years to get certain segments of the population out to be using online, particularly senior Americans they have to go in the grocery store and touch that tomato right before they'll actually buy it. And they've seen an incredible surge in the use of their online services. And it made me think, like, this kind of crisis is an opportunity to look at your services and really understand where innovation might lie. And so what can they do to retain that market in that particular segment as they go forward? So I think of it in that context. Never before has there ever been a more reason to say digital, digital, digital. And we have not transformed as much as we needed to. We all need to be pushing. This has shown us the need for digital telehealth and the kind of platforms. And then the last thing I would say is, when you look at the community-based organizations and the structures that are needed in place to help us understand when a social need is identified, where to go in that community, who to partner with in that community, and how to really prop up and help those community-based organizations, public health being part of that as well in our communities. I think those are areas that in times like these, we see gaps and we think, wow, that's where real innovation could drive.
Thank you, Alan.
So I think I'd say a couple of things. One, an immediate, what you can do right now is recognize, back to the question that was just asked, that there are a lot of folks who have to go to work right now. They can't not. And so if you know someone is in that situation, clearly the first line responders, stop and thank them, support them, do everything you can. It means so much to somebody who has no choice, to at least know that they're being seen and appreciated. We think a lot in my organization about there being no silos in the world right now. In the olden days, you would say, I work in financial services, I work in healthcare, I work in retail, I work in transportation. I think when someone wakes up in the morning, especially right now, they're not thinking about their life that way. They're thinking about things like, oh my God, I'm just a human, I'm scared, I'm trying to do my best. So I think we have to be broadening the definition of the product platforms and tools and products and solutions that we're bringing to bear to understand that if you're really designing around the human, then financial stress, caregiver stress, relationship stress, and workplace stress will be the goals that you're trying to accomplish and to actually serve and design for. And related to that, I would just think about those secondary waves, right? So the world is changed. And I love, Alan, I love to be able to follow you to build on what you're saying, because I'm a technology entrepreneur. I'm a complete geek, but the more that I get exposed, the more I am raw to the elements, the more I keep coming back to humanity. And how do we literally, what I picture in my head right now is how can I hold everybody as close as I physically can right now to love on them and to support that in my community when physically I have to be at least 6 feet away, if not actually locked away in my own home. And so I think finding ways through technology, but for that big part of the population that doesn't have access to technology the way we like them to, like a lot of our seniors who are in nursing homes with no support right now, what else can we be doing? What products and tools and platforms and solutions can we be delivering through the aisles of a Walmart? 50% of the US goes through a Walmart every single week, 95% at least once a year. So what are other ways to extend this idea of where we meet people where they are in the messy realities of their lives, to help support them and lift them up?
Thank you both so much. Such a great conversation, and a big thank you to the audience too for your participation in this. I hope you and your family are well. And I genuinely mean that. Thank you for joining today, and best of luck as you continue to address this pandemic.
Thank you for bringing us together, Nick.
Thank you.
All right, and so we'll transition now into our next set of innovation spotlights. I'm just going to be getting my slides going here. So this next is about, okay, now that we have to live at home, what does our virtual life look like? How do we continue to live, receive care, and explore when we are trapped at home? And our first entrepreneur, Sam, is from Ohm Practice. So Sam, welcome to the COVID-19 Innovation Summit, and I hope you are doing well.
Thank you, Nick. I was going to ask you the same. Why don't you hit the next slide really quickly? All right, so I'm Sam Takeff. I am the co-founder of Ohm Practice. We are live online yoga via two-way video, and we have group classes where your teacher actually sees you. So you can see what one of our classes looks like right here. We have an unlimited membership, which gives you access to 70+ classes a week on the public platform, and anybody can sign up for our platform for $24.99 a month. But notably, before now, our business model has been primarily working directly with insurers as a discounted reimbursable program, or with the best impact as a fully covered benefit. We've also been working with healthcare providers looking to address provider burnout, with governmental organizations like the VA, and with companies directly to offer our platform as a benefit to their members and teams. Why don't you go to the next slide? So obviously, because of COVID, we are seeing a community crisis right now in our industry, and we've had to adapt quickly to many of these changes. So pretty much overnight, all yoga studios around the world have closed. Teachers are out of work in an industry that already had super thin margins. It's incredibly difficult to make a living as a yoga instructor already, and students have been cut off from their communities. Additionally, we're seeing millions of people all over the country and the world looking to stay active now that we're all stuck at home. So to specifically address this, we've done a few specific things. We've added support for yoga and fitness studios to bring their classes onto our platform. Over a dozen studios this weekend alone. We've introduced an updated teacher subscription product to provide teachers with a one-stop solution to host and teach their classes on our platform. We've made it easier for companies to sign up. We're accelerating our work with insurers and helping them onboard quickly. And finally, for our students, we've been adding more classes to our public schedule, notably some family and kids classes for those of you grappling with family at home right now. Why don't you go to the next slide? So just my ask to you, if you're an insurer, you want to bring this to your members, a company who wants to bring together your team right now, or any of you who are working hard and need a yoga class for yourself, please don't hesitate to reach out to us. We are thankful for our community. Obviously, this is not the time we want to welcome everybody because of crisis, but we're working hard to welcome everybody to our platform and hope we can help you how we can.
Great. Thank you, Sam. And up next, we have Eran Or, the CEO of XR Health.
Hi, everyone, and thanks for having me. It's a pleasure to see this amazing community come together, try to cope with COVID-19. Slide. We are 25 days ago, you can do another slide. 25 days ago, we launched the first VR AR telehealth platform. And basically, we're using VR as a medical device for people to use back home while their clinician can monitor them remotely and even create support groups where the clinician can monitor and guide the patient through those difficult days. Can you slide, please? All our platform is FDA registered, FDA class 2, HIPAA compliant, and all our services are covered by CPT codes, meaning that the patient himself, basically the only thing you need to pay for is a rental of a headset, and they are getting all the services across the board for all the different conditions and a very affordable price. Slide. Our platform is basically have 3 different pillars. The clinician himself can control the headset, any headset from any PC, Android tablets, and probably iOS in the near future. They can see in real time what the patient is seeing and basically conduct a virtual reality treatment completely remotely. The patient himself is with the VR headset on, and we have several applications that they can choose from. We have applications for 3 major use cases: motor function, cognitive, and behavioral health, including stress relief and pain management. And after every session the patient is doing inside VR, we are generating analytics. So the patient himself can see the progress and the clinician can monitor them remotely. The patient can use the headset by themselves and basically the clinician can monitor their progress. The only ask that I have, one slide, is just helping us spread the word. We believe that our technology can help people cope while they're shut down in their houses. If VR basically allows them a technology or a way to escape, and all of that while their clinician monitor them remotely. Thank you.
Thank you, Eran. Up next to end the virtual care segment is Grace. I'm going to try to pronounce your last name, Andrews Kiewit. Sorry if I butchered that. But Grace is the Director of Marketing and Partnerships for Rendeavor.
Thanks, Natalie. Hi, everyone. Thank you so much for having me. I'm really grateful to have the opportunity to tell you a little bit more about Rendeavor today. Next slide, please. Since 2016, our mission has been to overcome social isolation and loneliness through the power of virtual reality and shared experiences. We primarily work with the older adult population, but I think over the last few weeks, we've all unfortunately experienced the effects of loneliness. For those of you who may not know, loneliness is as detrimental to your health as smoking 15 cigarettes per day. It's actually classified as an epidemic. The way that we've all been feeling is how many seniors feel on a day-to-day basis. Next slide, please. Rendeavor's hypothesis is that the basis of all human connection is shared experiences. So our platform was designed specifically to help stimulate conversations, to help build trust, to help people build meaningful relationships with one another. So a group of seniors will gather together in a room. They'll all put on virtual reality headsets and they'll participate in fully immersive experiences as a group. So they can travel around the world, they can check off bucket list items, they can revisit meaningful places like their childhood homes, and even stay connected to family through personal photos and videos. The best part is that they can talk about what they're seeing and really organically build connections with one another. As we all know, seniors are the most vulnerable population right now. So physical distance has become really critical, both to stop the spread of coronavirus, obviously, and also to really keep our seniors safe and healthy. Rendever actually happens to be in the midst of an NIH-funded study that focuses specifically on long-distance engagement, and the results so far have been extremely positive. So in response to the coronavirus, we're really accelerating the feature set that was built for that study specifically. For example, two-way communication, so that all of our customers can run sessions from safe distances. Next slide, please. We're also hearing from our customers that staff are incredibly overburdened right now, those on the front lines. So something as simple as a phone call to one of their lonely residents can really make a huge difference. So today we're launching something called the Friendship Volunteer Network, where anyone that's feeling lonely can request a friendly phone call from somebody on our team. And if you're interested in getting involved in that, please visit our website. If you know of any organizations that could benefit from the Rendever platform, or if you're interested in partnering with us in any way, please don't hesitate to reach out to me directly. And with that, I know I'm running short on time, so I'll hand it back to you, Natalie.
No, you're good. Great job, Grace. Great. So that was the end of our virtual care summit, and we're going to now transition into the fintech space. So really trying to understand data science and technology. How can they be leveraged to help businesses and consumers make smart decisions in a time of financial uncertainty? So to kick it off, we're going to have Gideon Taub, the CEO of Pinkaloo.
Awesome. Thanks, Natalie. Thanks for the opportunity to join this awesome event today. As Natalie said, I'm Gideon Taub, founder and CEO of Pinkaloo Technologies, and we democratize philanthropy and charitable giving. And that means that we help businesses of all sizes engage employees and their communities through philanthropy, and we help donors make better decisions around managing their giving. And so essentially, we make it possible for all companies to give back and to engage those employees and customers in that journey. If you can move to the next slide. At organizations that are less impacted, at least so far, by COVID, we are seeing all stakeholders look for ways to give back right now. And in particular, we're seeing corporates and donors want to give locally, knowing that so many people in their communities are struggling, particularly with hunger and with some of the other results that we're seeing. And at the same time, because of physical distancing, corporate volunteer events just can't happen. So organizations that had spring and summer events planned are looking for ways to engage employees and to make an impact. And so to be as responsive as possible, we're focusing all of our resources towards fast deployments. So we've committed to cutting launch times in half. So what typically might have taken 4 or 6 weeks before to get a full workplace giving program can now be launched in 2 weeks. And in fact, we actually just got a partner live today who first reached out to us 5 business days ago. And then I think our team did not think that that was possible. And we've been really excited to be able to support that. So across both of our solutions, we're seeing folks want to leverage it. We have a white label crowd fundraising tool that companies use to invite employees, customers, and even vendors to fundraise on behalf of a specific cause or a specific charity, such as a local food shelter. And then we're also seeing companies launch full white label workplace giving programs, oftentimes maybe taking budgets that they had from a volunteer outing and putting that towards matching funds for their employees to choose whatever organizations they want to fund and support in these trying times. And so if you move to the last slide, with that, if we can be of help as you and your organizations figure out how you want to be giving back and how you want to be supporting your communities and engage employees and customers in that, definitely please reach out. And we appreciate the chance to share what we're doing and what we're seeing in the market. Thank you.
Thank you, Gideon. So our next fintech startup is Stratify, and Laura Kornhauser, the CEO, will be speaking.
Wonderful. Thank you so much to the entire MassChallenge team for this opportunity, and thank you to everybody for joining this discussion. So at Stratify, we believe that the best outcomes are achieved when human and machines work in partnership, and our solutions are helping businesses combine information from data and combine that with their subject matter expertise to make more accurate predictions and smarter decisions, especially during these challenging times and times of financial uncertainty. So businesses are having trouble right now determining how their customer behavior is changing, finding reliable information sources about those changes, and then ultimately incorporating these dynamic changes into their models. While none of us know the future, especially right now, we can't ignore these challenges and continue as usual. Businesses need to find ways to learn from the past and apply those learnings in a relevant way to update their predictive models and their decision models now. If we can move to the next slide. During these challenging times, Stratify is here to enable these companies to use data from past crises, transform those insights from past crises, and make them relevant to the current situation that we're in right now using expert knowledge. In an ideal world, we would wait to retrain models on new data, but such data may not be available for many months for us, and businesses need to learn from the past now, use expert knowledge to make those learnings applicable, and incorporate this knowledge into their models and strategies so that they continue to conduct their business effectively. Our next generation rules-based engine allows you to combine the transparency of rules or logical expressions around data with your expert knowledge to make better decisions in the face of uncertainty. Next slide. Here's an example of how we're doing this now and helping lenders update their models to continue to evaluate borrowers and lend effectively right now. Lenders can take findings from the past crisis, adjust with their expertise to make that relevant now, and then use those adjustments to update their models in real time. And last slide. For any more information about how we're adding values to enterprise customers right now, enable you to extract relevant insights from any data and combine that with expertise, please reach out to me, and wishing you all the best health and safety during these challenging times. Thank you so much.
And thank you, Laura. And last but not least, we have Seth Brecher, the head of partnerships and customer success at Admit.
Yes, good afternoon. My name is Seth Brecher, and I'm the head of partnerships and customer success, of course, at Admit. I want to thank MassChallenge and all today's participants for this opportunity to share Admit's response and support of the community during this unprecedented time for us all. First, I'd like to share a bit about Admit. Admit helps families make smarter college borrowing decisions so they are truly better off after college. On this slide, you can see that we have different resources that we provide to students and families, including content, which includes Better Off After College, our Amazon best-selling book co-authored by Nick and Sabrina. In addition, we have our micro course in Admit's Learning Center, which shares critical information about the cost of college, financial aid, student loans, and the ROI of college and majors. Last week, through our Learning Center, we shared with the community the coronavirus resources and advice from Admit Guide. The challenges created by COVID-19 are of course new for all of us, but having expert advice has been helpful for our partners and the community in areas such as changing college enrollment deadlines, as well as the importance of learning about a school's capacity to support online learning. In addition to Admit's content, we also provide families with support through our award-winning software that provides personalized estimates and reports that shows what families can afford, how much they could expect to pay for a particular school. Not the sticker price, but the amount a student and family can expect to pay after factoring in need-based and merit-based aid. We also offer chat and email digital advising to support students and families with any questions they have about the college financial process. Next slide, please. Our micro course is at the heart of Admit's response to the challenges created by COVID-19. Our course is interactive, and you can see in front of you, we have learning outcomes that are stage-based, starting early in high school, going all the way through the college admissions and college financial decision process. We have videos, it's interactive, it's project-based. Next slide, please. Before I joined Admit, I was an educator in Washington, D.C. And as an educator, in March and April were kind of our busy season. And during this time, I had students and families coming for college financial advice. And with many schools closed across the US, this is a critical time for Admit's micro course and learning solutions to be provided to our partners. And through our partnerships, we're offering Admit to schools at no cost. And I hope, please email me at sbrecher@admit.me to learn more about how you can support us in the center. Thank you so much.
Thank you, Seth, and thank you to all of our entrepreneurs who presented today, because it's not just about healthcare right now, also about the economy, and I'm glad that we had an opportunity to hear from some entrepreneurs that are looking at this from another angle. We are looking at this as MassChallenge really from all. We were born out of the latest recession. Our mission is to solve massive challenges around the world through entrepreneurship and innovation, and we're excited to play a role in this. And we have that excitement with a sober responsibility that this is a serious challenge. So we appreciate all the innovators that are stepping up to the plate, all of our panelists that are doing great work. And I want to highlight one such relationship, and this is a use case to understand what happens when you do invest in innovation. What happens when you do team up and you do take the front lines and merge it with the innovators and make something happen. And that's with one of our champions, OSF Healthcare, and one of our alumni startups, CareSignal. So I'm thrilled to welcome Rob and Blake to the COVID-19 Innovation Summit. How are you both doing?
Doing well, Nick. Wish it were under better circumstances, but glad to be here.
I completely understand. How about you, Rob? Sorry, come again, Rob?
I said it's good to see everybody. We're doing okay.
Glad to hear that. So I guess let's dive right in. Tell us about what you're doing today to address COVID-19, Blake.
Sure. So CareSignal recognized that the next 2 to 4 months would not be normal, certainly not for any of our industry partners, health systems, payers, but also not for us as a company. Priorities have shifted. We need to shift with them. In short, COVID Companion is part of our response to that. It's a way for our providers to rapidly educate and engage their communities, provide credible information, and connect patients, including those who might not have even a primary care provider, with the resources and the knowledge that they need to stay as safe and healthy as possible.
And so, Blake, I have some slides up here. Do you want me to run through any of them, or do you want to run through some of them to give an overview of what you're doing today?
Sure. I think Rob can speak better to this than either of us, but that first slide really details the thesis behind this, which is it's important to focus on everything that every company and an innovator today has mentioned, and also keep in mind the big picture. And Rob?
Yeah, I mean, as this crisis continue to evolve, you know, we know that we need to care for patients across this continuum that you see here on the screen. And we've got a lot of innovations happening inside our institutions, inside our hospitals, in the ambulatory settings. We're doing a lot of work on providing care at home and doing virtual and all of those types of things as well. And you know, we've really partnered with Blake around kind of this larger circle of community engagement, getting education, getting resources, being a source of truth for those in our communities. I mean, OSF Healthcare, we have 14 hospitals spread across a good portion of Illinois between Chicago and St. Louis. So there's a lot of space there. There's a lot of people, but there's also a lot of space. So we're really looking for some lightweight, very scalable, easy to stand up solutions to really start the process of engaging our patients and others in the community who may not be our patients in this care, and making sure that we're providing them not only information but local resources, and then some very easy navigation back to us, and some of the new channels that we've set up as well.
Yeah, and I'm curious, how did this relationship come together? I mean, you're spinning up a lot in a pretty short amount of time to be able to respond to this. And as I'm sort of noodling through some of this, I mean, you have some great data that's coming in so far in terms of people that are onboarding onto this platform, but these kind of things don't happen overnight, do they? Yeah. Talk to me a little bit about how you sort of arrived at some of these numbers and sort of grew this relationship.
Yeah, I mean, Nick, we talked earlier in, I guess, last week, I suppose, and part of it is, the year's worth of work that we've put into innovation and building out the infrastructure and being out and exploring and finding really smart and dedicated entrepreneurs, leveraging organizations like MassChallenge Health Tech and others. And it's not a commercial for you, but it's an important part of our overall strategy that is now bearing some fruit. So when things now arise, we have this existing relationship with CareSignal and Blake, and it's a phone call to say, hey, what are you working on? Here's what our needs are, and then we just start that matching process and figuring out how to make this, how to design the product, how to really meet the needs that we're seeing in our communities.
And Blake, can you talk a little bit about, from the entrepreneur's perspective, how that relationship starts? So, this wasn't Rob giving you a phone call for the first time a couple of weeks ago, being like, "Hey, we need to spin up a response to COVID-19." Your first phone call was years ago. Talk to me about how your relationship started with OSF and how it's progressed over time, so that you're able to have this kind of immediate reaction.
It's a great question. I think that the OSF healthcare and CareSignal relationship is as you're describing, kind of the prime symbiosis of startup and health system. And it's not fair to say health system and innovator, because OSF is just as innovative as CareSignal, and I believe that now more than ever. But what you see is an ongoing dialogue, because Rob is on the front lines putting together an operational philosophy for an entire health system, millions of patients. And we have the opportunity to create technology that, when deployed correctly, can scale to a really significant proportion of those folks, but then also relay data back to OSF. And, it's certainly not something that happens overnight, but a lot of it is very late nights, especially in situations like this. And I think that's where, you need to know what your partners are going to put in and make sure that they're with you. And the data coming back speak for itself. I mean, since going live with OSF, our first partner a week ago, COVID Companion has now been used by a few dozen health systems across 47 states and Puerto Rico, of all places. And I credit OSF with that. That is because we had a partner who was willing to innovate with us and work fast with us to get to something really valuable that we could then spread well beyond just OSF.
That's just exceptional. The impact that's happening there, to have that scale so quickly. It's critical when we're trying to deal with this pandemic in real time. And Rob, I know that building those bridges internally and building that innovation infrastructure is no walk in the park. And when people think of innovation, sometimes they think of innovation theater. They think it's all sunshine and rainbows. We at MassChallenge believe that there's that, but there's also the science of implementing innovation and doing the culture transformation and building the processes that make it happen. Can you talk about the groundwork that you've been developing over the past several years to establish that innovation culture and that innovation process within OSF? Because a lot of organizations are having to deal with this digital transformation almost overnight. And if you can help educate the people that are listening in here on how they can start that journey and learn from some of what you've done, I would love to get your feedback on that.
Yeah, I mean, we do tend to talk about the sunshine and roses parts of it, but it's work, and it's been several years from a lot of people, a lot of the leaders through our organization. There's been a lot of executive alignment, executive support, and commitment. Obviously, that means funding and other things of that nature as well. As especially with our digital innovations over time, as those continue to expand and the number of partners growing, and we really found a need within our digital transformation to put together some real infrastructure. And thankfully, we've got some really smart leaders in our organization that looked at that and said, let's start treating digital as an asset class, and let's put together a group, a specific digital health group to manage a lot of this and some other things. So we put together what we call St. Gabriel Digital Health. We brought a hospital president in to run all of those digital assets and to coordinate that infrastructure that's really needed to support and launch all of those things. So, before we were kind of piecemealing it together and some side jobs, and everybody's doing a little bit of everything. And now having this group put together to really manage and scale and organize all of that work's been really helpful. But like you said, it's been years in the making to get to that point. But thankfully, we had a lot of foundational work done. And now we're taking, I've heard some people say around here, now we're taking some 5-year plans and doing them in 5 days or 5 weeks or whatever it might be. But, we're ready.
And it's a lot easier to do it when you have the infrastructure built to be able to stand that up. So now that you have everybody's attention, you can push these things through. So I would love to hear a little bit about how the implementation is going and sort of what some of the impacts are, because I want to let the audience understand. Okay, you've made these investments on both sides, the startup building the relationship with OSF, OSF building relationships with CareSignal. Talk about now that this solution is deployed. What does that mean? What are we getting now as a result of that?
Yeah, so I mean, I can talk a little bit about that. I mean, we're seeing some pretty good numbers coming in as far as the number of people on the system, and we're getting some good data back on that as well. But this COVID companion system is up and stable, so we're starting to look at, okay, so what's phase 2, what's phase 3 within that. We start with, like, we're going to do a marketing push that we have this text message system around engagement, and now how do we marry that with our AI enabled chatbot, Claire, who you can find on our homepage, and how do we how do we integrate this within the call system workflow or call center workflows, and how do we integrate it with various other partnerships that we're doing as well. And so it's a lot of that work now that's really getting from just launching now to optimization to integration with other workflows that are in place. So Blake, I can turn it over to you and let you kind of talk about where you see this going on your side.
Absolutely. I think, as Rob described, this is phase 1, and phase 2 and 3 are already in the works, focusing on more explicit community tracking and connections for folks who are asymptomatic or low risk symptomatic, and then even moving to staff support, making sure that all of the folks that are on the front lines at providers across the country have what they need. But the thing that needs to remain constant for all of those use cases is by far the lightest weight possible implementation, because what really is going to get in the way, what really, I hate to say it, is going to lead to folks losing their lives is friction. And that's also where strong partnerships that can be used to identify those friction points and eliminate them are so important.
And so to close out, I've got a couple of questions for each of you. Obviously, this is a challenging time, both in a medical and an economic perspective. And in thinking about the potential for sort of tightening the belt, we hear that sometimes that means that you're not going to invest in innovation. And when we were founded, we literally were founded at that recession, and innovation was a way that lifted us all out of it. And clearly, this is an example of how the innovation infrastructure that was there enabled this solution to happen. And so, Rob, I'm curious for you, like, why is it important to invest in innovation right now?
Well, I mean, it's not important to invest in innovation for innovation's sake alone. I think we have to be really focused on ROI, on fit with strategy, on what is the value that we're getting, more so than ever. I mean, these have always been questions, but more so than ever now. We don't have unlimited resources. We don't have unlimited dollars to spend. And so we need to be able to make sure that we're investing in things that are driving efficiencies, becoming force multipliers for our clinicians and staff, and improving outcomes. And that's where we're focused now. And I think those are wise investments to make, but not just for the sake of doing something neat.
Absolutely. I love that. It's a great way to frame what innovation should be. And Blake, what do startups or innovators like you need to succeed through times like this?
Partners like OSF, partners like MassChallenge, no surprise. But I think, lean into the fact that us health tech innovators right now are potentially experiencing a once in a lifetime opportunity to impact more people more positively than most folks ever have the opportunity to do, which is pretty meaningful. So, I mean, it's a mission question now. This is not a business opportunity. This is not a technology innovation opportunity. This is a chance to do unreal things.
Absolutely. And so thank you so much. You are our last panel discussion today. It means so much to have you innovating and working through this. I wish you all the best of luck to you, your families, and your communities, and what's to come. So thank you again for joining us today.
Thanks. Thank you.
So for everyone else that's still on the line, we would love for you to submit your solutions at solutions.covidsummit.health. If you're an entrepreneur, an innovator that was inspired today, that wants to be a part of the solution, please go to this site and share with us your solutions to COVID-19. And with that, I would like to thank you all for attending the COVID-19 Virtual Innovation Summit. May you, your family, your loved ones be healthy and safe through this pandemic. And we will talk again soon. Goodbye.